Welcome to the global launch of the Lancet series on heat and health. Good morning, afternoon, or evening, depending on which part of the world you're zooming in from. My name is Selina Lo. I'm a consulting editor at the Lancet. I'm also the executive director of the Australian Global Health Alliance, and I'm delighted to be the co-chair with Professor Ollie Jay from the University of Sydney today. I speak to you from Melbourne, Australia, and I wish to begin our time together by acknowledging the traditional custodians of the land on which I meet from, the land of the Wurundjeri people of the Kulin Nation. And I pay my respects to elders past, present, and future. I also acknowledge First Nations people globally and their connection to country, planet, and health of all species. I also wish to acknowledge each of you on this Zoom call, giving your time in trust to us today. So this is exciting. This is the Lancet's inaugural series on heat and health, and it sits on a long commitment in history to bringing the best science to address critical social challenges of our times that affect health, and particularly in planetary health for this theme. This series was published online late last week in a month that saw scorching heat waves from Greece to North America to Algeria, and also in the undocumented news reports of heat waves affecting migrants, movements, and refugee populations. It also comes, and this was not timed, with the recent Intergovernmental Panel Climate Change report, which laid bare the urgent need to act on climate change. The series is the brainchild of the three gracious co-leads, Professor Ollie Jay, Chris Eby, and Tony Capon, and the truly amazing efforts of a global authorship team who are joining us from several different countries today. We first convened at the University of Sydney workshop in 2018. 2019 ended with the Black Summer we experienced here in Australia, and then it was the beginning of the pandemic. So today we've brought together a stellar group of experts and commentators from many parts of the world in many different time zones to discuss the series papers and the context in which they land. For some of us, we're talking to you from lockdown in Melbourne and Sydney, and this is the closest we're going to get to do some international travel for some time. And as you know, we meet and we live in unprecedented times. And this calls for unprecedented leadership and imagination by leaders and by individuals. The pandemic has shown that we can, as a global community, work and communicate evidence for global public good. But it also requires that science can reach those who make decisions in a timely fashion. Technology and social media, as we know, can assist or burden this endeavour. So we hope that today, as you engage in this session with the technology that we're using, that you also think as a global and local citizen about those you serve, and really challenge our panel and team with the questions that can assist in placing this huge effort of work well in the world in which you live. Our jam-packed agenda today is to have the two lead authors first present the two papers of the series, followed by an expert panel discussion. We request that if you have questions, to start placing them in the Q&A tab at any point in this presentations, and we will endeavour to protect as much time as possible for question time. Please address your question to the speaker you wish to respond if you have a speaker that you prefer. And I particularly make a call to any students on this call today to identify themselves as such so that we can respond to you. This session will be recorded and placed online on our landing page for the Heat and Health series of the Lancet. Please advise us via the chat button if you're experiencing any technical difficulties, and we'll work to manage in the background with the fantastic team and hosts at the University of Sydney who are hosting this launch platform for us today. So I'm now going to hand over to my co-chair, Professor Ollie Jay, to say a few words about the series itself. Ollie is the reason we actually have a series to present, because 4 years ago, on a really scorching, uncomfortable summer afternoon, he pitched his work on thermal heat simulation modelling. Not a science I'm versed in, nor most editors, I think, at the Lancet, but he communicated so clearly to myself and also later to the editor-in-chief of the Lancet, and the history of this series began at that moment. Ollie is a physiologist and a professor of heat and health at the University of Sydney, and he's the director of the new Sydney-based Global Heat and Health Research Centre. Delighted to hand over to you, Ollie.
Thank you so much, Selina, for that wonderful introduction. I'd just like to begin by also acknowledging the traditional owners on the land on which I speak to you from this evening. They are the Cadical people of the Eora Nation, and I'd also like to pay my respects to elders past, present, and emerging. It really is an honor to be speaking to you today as one of the co-chairs of the Lancet series on heat and health, alongside my colleagues, Professor Kristie Ebi and Professor Tony Capon. This series was initially born out of the realization that there were many researchers from a variety of different disciplines essentially working on the same topic, which is heat exposure and human health. Yet it seemed to be very rare that people from these different disciplines tended to interact. In the face of a rapidly changing climate and the increased prevalence of hot weather and heat extremes, the challenges facing us all in terms of future health impacts are very complex. To learn not just how to survive a warmer future, but thrive in it, it's becoming increasingly clear that comprehensive solutions are needed. To achieve this, we collectively determined that there needs to be a greater effort for all of our disciplines to learn from one another and synthesize the expertise that's available on our shared topic. To this end, we assembled a 15-person strong multidisciplinary authorship team from 8 different countries spanning 4 different continents. We're able to draw on expertise of world-leading researchers in the areas of physiology, the built environment, sustainability science, sports medicine, epidemiology, environmental ergonomics, climate science, climate change impacts, human biometeorology, occupational health, heat health action plan development and communication, and planetary health. All of the authors are listed here today, and I'd just like to take the opportunity to extend my deep gratitude to all of them for taking part in this particular project. The final outcome was the production of 2 papers that were published in the Lancet last week. Paper 1 was led by Professor Chris Eby, and this outlined the problem of extreme heat and hot weather in a changing climate from the population level down to the individual. It also describes how heat has far-reaching impacts across a variety of sectors. Paper 2, which I had the good fortune to lead, discusses various solutions that can be adopted in a range of different settings to increase heat resilience, with a particular focus on people in low resource settings, who can be the most vulnerable to the threat of extreme heat, yet contribute the least to the problem in the first place. Now I'll hand over back to Selina.
Thank you so much, Ollie. So I'm delighted to introduce Professor Chris Eby, who will present paper 1 of the series. Chris is a professor in the Center for Health and the Global Environment at the University of Washington. She's a global authority on the health risks of climate change, and she's a lead author on the Intergovernmental Panel on Climate Change report. We are particularly grateful to Chris for agreeing to do this launch at an extremely early time in her morning. Over to you, Chris.
Thank you very much, Selina, and thanks for everyone who are joining for your interest in this webinar. And I want to add to what Professor Jay had to say, that not only did the author team have amazing expertise, they were also very deeply engaged in producing these papers. We had intense and very productive exchanges across the production of these papers, so that they are a true synthesis across a wide range of scientific areas of expertise. This one slide summarizes paper 1. Thanks to Professor Jay and his group, we have an outstanding graphic to help people explain what happens when our bodies become too hot, the different ways that our cells and our organs react as our core body temperature increases, and the way that that affects our organ systems and the different ways there can be failure. It's incredibly important to remember that no one needs to die in the heat. We've understood a lot about heat for many, many decades. And when we have heat waves, essentially all of those deaths are preventable. So when we look at the numbers, for example, here in the Pacific Northwest, over 1,000 deaths, excess deaths occurred. Those people didn't have to die. And better understanding heat and its impact on our health, we hope will be useful as cities, regions step forward into building more heat action plans. We looked at not just mortality, we looked at some other issues, occupational health and productivity. We also looked at sports injuries and illnesses. a topic that, as Professor Jay said, is just scattered across the literature and brought that information together into a series of synthesis statements that we hope will be helpful. As you can imagine, we looked at the physiological limits of heat and how a very wide range of factors can reduce those limits, and then looked at how climate change will continue to increase morbidity and mortality and the urgent need to take additional action to protect our health and our well-being as we go into the future. Selina?
Thank you so much, Chris. I now wish to invite Professor Ollie Jay back onto the Zoom stage to present paper 2 of the series. Over to you, Ollie.
Thank you, Selina, and thank you, Chris, for that wonderful synthesis of paper 1. So like I mentioned before, I had the good fortune of leading paper 2, and this is really focusing on the solutions in view of the problem that's outlined in paper 1. We have 4 key messages. The first one is that while air conditioning is certainly very protective, it is generally inaccessible to many of the most vulnerable to extreme heat. It tends to widen the inequality gap that already exists in today's society. We know that cooling strategies can be applied at a range of different levels along what we've termed the heat cascade, and I'll show you an illustration of that shortly. Cooling strategies can be applied at the landscape or urban level. They can also be applied at the building level, and this can increase the heat adaptive capacity of the most vulnerable to heat waves. However, it's important to keep in mind that those strategies that we're applying at the landscape and building level generally are longer term solutions, as opposed to something that we can advise people to do if a heat wave is coming tomorrow. To that end, we describe sustainable and accessible cooling strategies that can be adopted at the individual scale to effectively reduce the physiological heat strain, even in low resource environments. I refer to the physiological heat strain there because ultimately that's what's really important from a health perspective. We know that people get sick, people die because of the physiological heat strain that arises from extreme heat exposure and body heating, and that's described in Chris's paper in paper 1. Once we have this information, it's really important to have a plan and have the right plan, and when we do have it, it can be delivered in the context of robust and evidence-based heat health action plans that are needed to optimize heat health protection. I'll just finish off now by just showing a couple of illustrations. First of all is something that we coined the heat cascade, which demonstrates the way in which heat is exchanged similarly irrespective of the level at which we're operating. We can be at the landscape or urban level, heat exchange via radiation, convection, and conduction, and evaporation. And we can do things to the landscape in order to augment heat loss so that the urban heat island effect is mitigated, and therefore local temperatures are not as high as they would be currently today. If we then zoom into the building level, this is where the heat now is then translated from the outdoor environment to the indoor built environment. And there are things that we can do to the built environment, adaptations that we can make through changes of insulation, changes in glazing, and other factors to reduce the indoor ambient temperatures relative to outdoors. Then finally, we arrive at the individual level. So an individual can be exposed to a given environment. And there are things that we can do to augment heat transfer at the skin surface to reduce the physiological heat strain that arises in terms of thermal strain, which is how high the core temperature rises, how dehydrated an individual becomes, the level of cardiovascular strain, which is enormously important because we know that a lot of people die or get hospitalized during heat waves due to cardiovascular complications, and also renal strain. Another really important emphasis here is that it's not just the hot environment that really matters, it's the hot person. So what we can do is we can manipulate heat transfer at the skin surface without changing air temperature to cool a particular individual. And this is really important when we're thinking of more sustainable and accessible ways of cooling the most vulnerable during heat waves. I'll finish off by referring to 2 infographics that were beautifully developed by the Lancet group. This is based on the findings of paper 2. We detail the top 8 sustainable and accessible ways that we know that we can keep cool. And this is based on physiological evidence that not just my group, but my colleagues around the world in the thermal physiological community have developed in order to enable us to identify the best ways to mitigate that physiological heat strain that arises during extreme heat exposure. And on the right-hand side, we detail the way in which these different cooling strategies can be applied to a range of different settings. The settings that we discuss specifically in this particular paper are aged care homes, workplaces, schools, playing sport, mass gatherings, refugee camps, and slums. I'll finish there and I'll hand over back to Selina. Thank you.
Thank you so much, Ollie and Chris, for brilliant presentations. So we're now going to open our expert panel discussion. Our first panelist is Dr. Virginia Murray. She's the head of Global Disaster Risk Reduction for Public Health England, an executive committee member of the Global Heat, Health and Information Network, and the co-chair of the WHO thematic platform Health and Disaster Risk Management Network. We know that the pandemic kept her, like many others, very busy. So Virginia, we're so grateful that you're able to join us today. And we look forward to your perspective on low middle income country and the global perspective of where this series lands. Thank you. Over to you.
Selina, what a privilege to be invited to join the panel. These two papers that Professor Ebi and Professor Jay have presented are absolutely critical, in my view, to implementation of some of the UN landmark agreements, which will affect people at all levels. The Sendai framework on disaster risk reduction, the Sustainable Development Goals, and the Paris Agreement all were agreed by the UN heads of state in 2015, and it's the implementation of these that are so critical. If I turn to the Sendai framework, Professor Ebi reported that so recently 1,000 excess deaths occurred in the North American Canadian heat dome incident that happened earlier this year. This is really worrying because the Sendai framework calls for the reduction in mortality, the reduction in people who are affected, the understanding of the economic loss, which of course relates to agricultural and occupational engagement. When heat is really high, it's very hard to work. But it's also calling for the really important issues about basic infrastructure, protecting healthcare facilities and educational facilities. And heat makes it really hard to use these facilities well and to make sure they function appropriately. And of course, with many extra ill because of heat waves, then there's real concern. So one of the things that the Sendai framework called for is an increase in every country's knowledge of their risks, international cooperation, and very importantly for heat waves, early warning, awareness of all the risks. One of the things that has come out of this is that heat waves are really critical. UNDRR, the United Nations Office for Disaster Risk Reduction, and the International Science Council have been reviewing hazard definition and classification. And I am very glad to say that at last, because I have been fortunate to be the chair of the technical working group, heat waves are now included as a hazard that needs to be recognized globally. And we hope this will help to influence how networks will occur in managing these events more effectively. Now, of course, in the UK, one of the actions that will happen later this year, will be the Conference of the Parties on Climate Change, the COP26, which will be working in the UK with partnership with Italy. And we very much hope that these wonderful Lancet publications can be taken there to help to influence it. But where we do know it'll go will be the incredible network that has been built by the Global Heat Health Information Network, who are really concerned to bring the evidence of the extreme heat as a silent emergency to all, to make sure that it's really accessible and can be useful, usable, and used. So thank you again, the wonderful authors. Thank you again, the Lancet, for this work. It is so important for us all. Selina, back to you.
Thank you so much, Virginia, and for joining us. So our next panelist is Dr. Rupakumar Kali. He is the Executive Director of the International Climate and Ocean Variability, Predictability and Change Monsoon Project Office at the Indian Institute of Tropical Meteorology. Earlier, he was the Chief of World Climate Applications and Services at the World Meteorological Organization, the WMO, in Geneva, Switzerland. He's going to talk about the type of work done in WMO and giving heat waves in India and the experience there as an example. Thank you so much. Over to you, Kumar.
Thank you, Selina, for the nice introduction. And thank you for the opportunity to be part of this distinguished panel. And first of all, my hearty congratulations to the authors of both the papers, which are complementary and also comprehensively cover the exponentially increasing risk to human health and well-being by the extreme heat. And as convincingly demonstrated or illustrated in these papers in terms of our understanding as well as effective solutions, a systematic and scientific approach to the problem can dramatically reduce the suffering and deaths due to extreme heat, which is totally unnecessary, as Professor Kristie Ebi has pointed out earlier. While heat impacts and the available options to reduce them range from individual, community, city, national, regional, or even global levels, there is a common thread in the form of contextualized information on the climate in terms of extremes as well as the associated health impacts to empower appropriate actions. So providing such information and feeding them into decision support for response actions is in the domain of what we call climate services. Recognizing this, in 2009, at the World Climate Conference 3, under the leadership of the World Meteorology Organization, WMO, a global framework for climate services was established. It is called GFCS. The GFCS has an overarching goal to enable better management of climate risk with science-based information, and the GFCS has identified health as one of the priority sectors for its implementation. WMO partners with World Health Organization, WHO, to implement the GFCS for the health sector with a major focus on the heat health impacts. WMO and WHO jointly issued a guidance document on heat health warning systems, which is currently being updated. And in fact, this version had Professor Chris Eby as one of the authors. So it is very nice that I'm referring to this guidance document on this occasion. WMO and WHO have also established joint climate and health project office, as well as a joint study group to assess research and operational needs and requirements, including data, products, services, capacities for the generation, provision, and application of scientific evidence related to climate, weather, water, and environmental impacts on health. There is also an increasing recognition that we need a regional and local approach in developing heat health action plans, as the related issues are highly context specific. For example, the Global Heat Health Information Network is actively supporting the development of a South Asian Heat Health Information Network. And South Asia has a very large and highly vulnerable population exposed to heat risk. And the SAHIN, the South Asian Heat Health Information Network, is making rapid progress in developing heat health action plans, including at the city levels. These two papers in the Lancet series are timely and provide the scientific underpinnings to the efforts being made by WMO, WHO, and other partners in helping the society cope with the heat and make a real difference. Thank you. Over to you, Ollie.
Thank you, Kumar. I'd now like to introduce our third panelist, which is Carolyn Broderick. She's a staff specialist in sports and exercise medicine at the Children's Hospital of Westmead here in Sydney, Australia. She's also an associate professor in the School of Health Sciences at the University of New South Wales, Sydney. In a parallel life, she's also a world-renowned sports physician. She was deputy medical director at for the Australian Olympic team in the 2016 Rio Games. And since 2017, she has served as the chief medical officer of Tennis Australia and the Australian Open Grand Slam tennis tournament. She therefore knows an awful lot about the heat, and she'll now share her perspective now. Over to you, Carolyn.
Thanks very much, Ollie. It's so great to be included in the panel, just to give a perspective of the impact of heat on sport and physical activity, which is the area that I'm interested in. And it was in my role as Chief Medical Officer at the Australian Open that I really became aware of the health impacts of heat on athletes. The Australian Open, for those of you not familiar, is an international tennis event that's played in Melbourne in January, which is the hottest month of the year. And that first year that we had temperatures in the low to mid 40s, which is around 110 degrees Fahrenheit. And that's where my collaboration with Ollie J began. It really became very important to work on developing an extreme heat policy to mitigate the risk. In the past, or in 2 of the past 4 years of the Australian Open, we've had to suspend competition as a result of extreme heat. And 1 of the last 4 years, we've had to suspend competition because of bushfire smoke. And that's really been the experience of a lot of Australian summer sports in the last decade, and also not just Australian sports, but overseas international events, including some of the test events leading up to the Tokyo Olympics. So it's important that community and professional sports adapt to global warming and make plans to mitigate the risk, which is only increasing. There are a number of practical actions that can be taken to reduce the risk of heat-related illness, and by a number of different stakeholders in sport, many of which are mentioned in paper 2 of the Lancet series. So there's the role of designers of sports facilities, in intelligent design of sports facilities with regards to ventilation and reflection of reflective roofs, green spaces. Then there's the role of individual participants and how they can mitigate risk, and also sporting organisations. And a lot of this is covered in the second paper of the series, but I just wanted to highlight the role of extreme heat policies. And here on the screen, this one on the left-hand side, you can see is our Australian Open heat stress scale that was developed in collaboration with Ollie and colleagues at Sydney University. The key to a good extreme heat policy is to really stratify risk and then have specific intervention at various thresholds of risk to mitigate environmental or exertional heat illness. So this one has specifically been developed for the sport of tennis. It takes into account the metabolic heat production of tennis players, the clothes that they're wearing and their ability to dissipate heat, and then the environmental conditions listed below. Then Ollie, I might just have the second extreme heat policy. It was one then that the same team, we went on to develop for Sports Medicine Australia, which relates to the 50 most commonly played summer sports, outdoor sports. And again, we stratified the risk based on metabolic heat production and the clothes that they wear, and then classified the risk and specific interventions there, which are listed to below. There are a number of other things that sporting organisations can do in terms of scheduling, although at least in professional sport, media often dictates scheduling, and also messaging and education. Similarly, with regards to the individual, there are a number of individual interventions that can reduce the risk of exertional heat illness. And perhaps the most effective personal preventative measure is heat acclimatisation. Most of the athletes that went into the Tokyo Olympics would have spent 7 to 14 days exercising in the heat in similar conditions to Tokyo to prepare themselves for that. Similarly, as Ollie showed in that second paper, there's a wonderful infographic that just outlines the effective cooling mechanisms that individuals can use. And the great news about that is that they're low cost and they're equally able to be provided in community and low resource settings as they are in professional sport. So there are some of the individual aspects of cooling. But I think globally, we need to ensure that a hotter climate doesn't impact on people's ability to be physically active in the summer months, and that it doesn't contribute to the other great global disease burden, which is non-communicable disease caused by physical inactivity. Thanks, Ollie, back to you.
Thank you, Carolyn. And just like to introduce our final panelist, that is Professor Karen Seto. Professor Seto is the Frederick C. Hickson Professor of Geography and Urbanization Science at Yale University. She's now going to share her perspective as one of the world's leading experts on contemporary urbanization and environmental change. Over to you, Karen.
Thank you, Ollie. Well, first of all, thank you for the opportunity to join this very important discussion. If we look at these two papers in the context of contemporary urbanization, I see three key messages. I mean, one is that the scale and speed of contemporary urbanization means that many, many more people will be exposed to heat risk in the future. What you see here on the screen are some forecasts of urban expansion going out to 2050. What we are seeing is that the world is going to add, or is already adding, 1.5 million urban dwellers every single week. Every single day, an area equivalent to about 20,000 football pitches is converted to urban area someplace on the planet. And models show that the growth of these urban land areas is also modifying climate. And so urban expansion will increase the urban heat island, will increase temperatures in cities. And so what we see is that elevated temperatures will increase during the day as well as during the night. And urban expansion modifies not only the temperature, but also increases or changes the humidity. And so, again, one of these key messages of these papers in the context of urbanization is that the scale and speed of urbanization will lead to many, many more people exposed to heat risk. And what we see is that urban expansion through 2050 could increase daytime temperatures up to 5.6 degrees C in some places. Now, in terms of the ways in which urbanization and how we design cities, I mean, this clearly has a very big impact on how we might mitigate the effects of heat. As one of the articles mentions, green infrastructure, cool roofs, is essential for mitigating heat in cities. Green infrastructure includes a wide range of elements, from parks to street trees to green and cool roofs. And green infrastructure can mitigate heat, but it also helps to treat stormwater. It can mitigate flooding. It improves air quality. Green infrastructure creates oxygen. It can sequester carbon. So it has many, many co-benefits in addition to mitigating heat. The literature shows that green infrastructure can mitigate urban heat island, especially by reducing daytime temperatures. But if we really want to reduce nighttime temperatures, we need to increase green infrastructure, so greenery, street trees, etc. But the other thing we need to do is we need to reduce impervious surfaces in cities. That is really essential for reducing nighttime temperatures. So impervious surfaces is affected or shaped by things like the design and layout of streets and the built environment. It affects things like how much and the layout of impervious surfaces, things like block size and intersection density. And so the form and structure of how the built environment is designed strongly influences the micro-urban climate, and it affects things like how well heat is dissipated or trapped in the built environment, especially in the night. Next slide, please. The good news on all of this is that if we look to 2050, more than 60% of the projected urban areas that are expected to be in place in 2050 have yet to be built. So there is quite a window of opportunity to shape how future cities are designed to affect heat risk and exposure. Thank you. Over to you, Selina.
Thank you so much, Karen, and thank you very much to all of our panelists. I am now, before we open up for our Q&A, I'm going to invite Professor Tony Capon up to the Zoom panel to discuss the context of the series in terms of sustainable development. And Tony is the director of the Monash Sustainable Development Institute and the series co-chair. He was a commissioner on the Rockefeller Foundation Lancet Commission on Planetary Health, a director in global health at the United Nations University in Malaysia. And his one claim to fame is also that Tony was the first world professor in planetary health at the University of Sydney, a chair of which he also holds at Monash University. Over to you, Tony.
Thanks very much, Selina, and terrific to be with you all today. So a few words just, I guess, of context, given that we're all grappling with the pandemic around the world at the moment, and we need to be thinking about the advice we provide in the context of both of these big public health challenges. Controlling the pandemic, of course, necessitates physical distancing. And this leads to advice that requires people to stay at home, lockdown conditions like we have here in Melbourne this evening. Whereas during heat waves, public health advice can include leaving home and indeed congregating in cooling centres, particularly for those that don't have access to air conditioning at home, those that can't afford air conditioning at home. So clearly this is very context dependent, as Kumar has said. But when we have converging challenges as public health folk, we have to be grappling with these competing needs. And certainly this series has shown very clearly, as you can see from that infographic that Ollie pointed to before, that there are a range of low cost, low energy options for staying cool at home during the pandemic. Virginia referred to the Sustainable Development Goals, and this series addresses a number of those goals. SDG 3, good health and well-being, of course. Also, SDG 6, clean water. SDG 7, affordable and clean energy. SDG 10, reducing inequalities. SDG 11, sustainable cities. And SDG 13, climate action. Global cooling has become a major sustainable development challenge. With rising incomes in middle-income countries, including China, India, and Brazil, we're seeing rapid uptake of air conditioning for cooling, with escalating energy consumption, much of this coal-fired at the moment. This is creating a vicious cycle, with rising carbon emissions from energy demand exacerbating climate change. This series and other related research is grappling with this big sustainable development challenge, identifying sustainable and affordable approaches to global cooling that bring human physiology into our calculus. Back to you, Selina.
Thank you so much, Tony. So inviting all of the participants on this Zoom chat to please put your questions in the Q&A. We will be pushing some of them to answer live. I would like to start by asking the perspective of the panelists in terms of how you see, from your perspective, where the series and also the work that you do can address equity issues.
Thank you, Selina, and I'm happy to kick that question off. Equity is incredibly important to address as we think about how we can better manage a warmer future. I'll speak specifically from the United States. We have regions in the United States that were redlined. It was a historic action to reduce the ability of our Black and brown citizens to be able to get mortgages. Those regions have fewer trees, they're much hotter. And so we need, as we move forward and as we modify our infrastructure, as you heard from Karen and from others, to take into account that we have these legacy issues that have to be addressed, so that we can ensure that everyone is going to be protected and we can reduce some of the inequities we already have. Over to others.
Chris, I can just quickly jump in there. I think in terms of equity, it speaks to one of the other questions as well, is with respect to the way in which we choose to cool. So we outline in paper 2, of course, is that one of the fastest growing, or the fastest growing way in which we try to mitigate the ill effects of extreme heat, or coping with hot weather and extreme heat, is through the use of air conditioning. This use is growing in worldwide. That becomes a problem because, for 2 reasons. First of all, from an environmental perspective, it can be quite damaging. It uses a lot of energy, it creates a lot of CO2, and it starts contributing to a vicious cycle whereby we're using a lot of energy to cool our homes, but that then is that the greenhouse gas emissions are generated as a function of producing that electricity, which then contributes to future climate change. So that becomes problematic. The other issue is, and this is actually one of the reasons why in paper 2 we really do focus on sustainable and accessible cooling strategies. So I think that's really important to emphasize. Another thing that's really important to understand is that AC can't necessarily be the solution for everybody, because in many ways the most vulnerable don't have access to air conditioning, through the fact that it's quite expensive to purchase in the first place, and it's very expensive to operate. There's lots of studies that have demonstrated that people have air conditioning, but they can't afford to operate it. So that's why, again, it's really important for us to think about more sustainable and accessible ways which people can simply cool in very low resource environments. And much of the recommendations that we make in paper 2 speaks to just using either moving air instead of chilling it, and or applying water to the skin surface to enable evaporative heat loss, which is a very powerful way of cooling the air, or cooling the person, beg your pardon.
And I'll take this moment to underscore Ollie's point of we need to focus on cooling individuals and not necessarily very large spaces, that we can successfully cool ourselves without having to use air conditioning everywhere, acknowledging there are some places where it will need to be used.
Okay, there's a question from Shah, directed to you, Chris. With regard to Canada's record heat incident of Lytton, where the population never expected such soaring heights, how can preparedness and adaptation measures be co-opted using early warning and early response to the last mile? Thank you.
Thank you very much for that question. It's important as we're seeing such significant increases in the intensity of heat waves. And one opportunity is to use stress testing. Stress testing is an approach that's used, for example, for banks. They have to meet certain metrics to be sure that they can handle a turndown like we had in 2008. It's also used by the military. And Health Canada is the first organization that is funding stress testing, including of heat action plans, so that as people think about their heat action plan, they can go through and do a desk-based exercise to see how well they could manage with temperatures so far outside of historic experience. And that is an approach to increase preparedness for these very extreme events that we're expecting to occur more often with climate change. Thank you. Selina?
I'll just quickly take over and ask a question that's been posed to which I think Karen can take. This is from Laura Fleming, and Laura asks, a fascinating discussion regarding green and blue space infrastructure to help with heat mitigation. Can you also discuss evidence that green-blue infrastructure, especially in urban areas, offer physical and mental health co-benefits, especially if equitably accessible and of high quality? Karen.
Well, thanks for this question. The question, the comment at the very end of the question is really essential, that it's not just a matter of having green infrastructure in a city, but that it actually must be well distributed and it must be really high quality. And Chris already alluded to this earlier when she talked about the situation in the US. I did want to say I did put a couple of example papers in the on the chat. I put a link to 3 different papers. There's a very large body of scientific evidence that shows the health, both the physical health benefits of green infrastructure in terms of access to green space for exercise and recreation, but also a lot of literature that shows the benefits for mental health as well. Incredibly, we even though we're an urban species, we have derived significant health benefits, mental health benefits, from even just seeing green space. We don't even have to be in the green space. We can even see the green space. And so if you think about the co-benefits of green infrastructure in terms of trees, mitigating heat and also mitigating flooding, and the effects on air quality, I mean, it's clearly one of these pretty simple win-win solutions to both benefit cities and also benefit people who live in cities. I'm happy to provide more references beyond these 3 if that's of interest.
Okay, I'm going to take the next question, which is from Jericho. It's a question probably for both you, Chris and Ollie. Question for both of you. Good morning. I'm in the midst of my PhD in thermophysiology of chronically diseased individuals, specifically type 2 diabetes. We know that the respective medications do have specific mechanisms to increase thermal strain. However, much of those mechanistic studies extrapolate based on healthy individuals. These drug interactions would undoubtedly have a larger and different impact on the chronically diseased. What are your thoughts on polypharmacy, especially in the elderly? Would there be greater need for medication studies in specific populations? And is this ever going to be ethically practical and possible? Thank you.
Ollie, would you like to start?
Sure, yeah, no problem. Thank you for that excellent question, Jericho. I think what we do know is that, in fact, that the state of the literature with respect to the influence of different prescription medications on their capacity to regulate body temperature is pretty sparse, actually. There's a lot of information in existing public health guidance that speaks to the impacts of different prescription medications, but it's largely theoretical. And what we don't know is what the dose response relationship actually is. So, for example, we may have an antihistamine, or we may have a serotonin uptake inhibitor that is, in theory, anticholinergic. But the level of studies that are available have demonstrated how anticholinergic it is in the context of how much it actually impacts the ability to sweat and subsequently regulate body temperature is actually currently unclear. Now, of course, when we first do these mechanistic studies, I think it's important to understand the proof of principle. But you're absolutely right that once we do understand that proof of principle, we must then extend those findings into those specific populations that are taking it. So then extending those type of studies into, let's say, a particular medication that maybe might be more common in elderly individuals. So I think this is a really important question, and it requires an awful lot of work in the future through collaborations with people in pharmacy and pharmacology, and also thermophysiology as well, and people in public health. So we can then, once we have those answers, we can then translate them to changes in meaningful public health guidance.
Thanks very much, Ollie. I'll give you a rest and I'll ask the next question, if that's okay. It might be for you, though. The next question is from Gail. Immediate response to heat has been and will be AC, as this will cause increased heat production and carbon emissions, as well as leaks of greenhouse gas, those used for their cooling effects. Are projections of this increased contribution to global warming by increased AC use, air conditioning use, available, and part of the message taken to public and stakeholders? I'm sure any of you can answer this question, but who would like to take it on?
I can start. It is true that if your air conditioner is run by electricity that's produced using coal in particular, then that air conditioning does contribute to greenhouse gas emissions. In the future, the question is how much we will transition to renewable energy, which means that air conditioning could be run without producing greenhouse gas emissions. It still, with current technology, will pump more heat into the environment, increasing urban heat islands. The question around whether there's projections about cooling and heating degree days and the extent to which these shift in the future, the answer is yes, there are estimates about this. These are produced typically through integrated assessment models. I don't have access to any of the references at the moment, but in March, the Working Group 3 contribution to the IPCC 6 assessment cycle will be released, and that will certainly have statements about cooling and heating degree days and the extent to which electricity generation will shift as temperatures get warmer, and then what that means for greenhouse gas emissions. Thank you.
So I have a question for Carolyn. This comes from Chelsea Gao. He's asking, how does the heat risk chart compare to the application of the WBGT index? Are personal factors like fitness, heat acclimatization, activity intensity, solar radiation, wind, etc., incorporated to categorize the heat stress risk level?
Yes, so with our heat stress scale, we've taken into account all 4 of the environmental parameters, and we've measured them on site. So rather than wet bulb globe temperature, which in our instance is estimated by the Bureau of Meteorology, we've actually measured all 4 of the environmental parameters on site. What we haven't taken into account is acclimatization state and physical fitness. We've looked at modelling of average metabolic heat production in certain athletes, but you're right, we don't actually take into account acclimatization, which would definitely impact on risk levels, and that's one of the instances in terms of the scales that we've created. We've tried to direct it at the most vulnerable person exercising. So in the instance of a team sport, we've directed it to the most vulnerable person, which might be the person with the most protective equipment. But similarly, people who are acclimatized would be less vulnerable, and we haven't made accounting for that in the heat stress scales that we've produced thus far. Was there any other part of that question, Ollie, that I missed?
No, I think that was good. Thank you, Karen. Selina.
Thank you very much. I have a question for Virginia, and perhaps you and Chris, Ollie. Like to ask about whether there are international guidance such as WHO that can be informed by the new information that this series has produced, and what your advice would be.
Thank you very much for the question. The whole purpose of these wonderful papers, in my view, is that they should help to inform policy and practice. They have shown the very worrying impact of heat on health, but also processes by which we might be able to mitigate it. Knowing that climate change itself is not regarded as a hazard, but the consequence of climate change, such as heat waves, are hazards, we know that we need this evidence really clearly to try and inform systems where decision makers will take action. So one of the things that I would like to suggest for these incredible authors, Ollie, Tony, and Chris, is that I think we need a policy brief, Selina, from this. A policy brief that could be used to share with policymakers on the key outputs from these papers to make sure that we can take these to organizations such as the National Disaster Management Agencies in countries, to the Sendai Framework focal points, to all those who are very much engaged in hazard mitigation and disasters mitigation. And by sharing that, we might encourage the use of heat health action plans, just as Kumar shared with us so clearly when he talked about his work with WMO. But we know the power of the World Health Organization and the World Meteorological Organization by working together are really seeking to change this. And the Global Heat Health Information Network is a group that is trying to bring this evidence in a way that will make it much more available to all. So I really will put out a call that we use these papers that are so well thought through and so carefully delivered in a way that we can really make a difference to how we manage the impact of heat. Sadly, not effectively, particularly for this year, but certainly in future years. Many thanks. I hand over to Chris and Ollie.
Thank you, Virginia, for your very, very helpful answer. And I'd just like to briefly add to that there are international standards. They're not applied in all countries around heat, but they focus on occupations such as manufacturing, and they don't typically focus on outdoor workers. And that is of very deep concern as we go into a much warmer future. In the United States, only 3 of 50 states have any kind of regulation to protect our outdoor workers during episodes of very high heat. And that is a clear gap that needs to be addressed. Again, speaking just from my perspective, we had a massive heat wave here in the Pacific Northwest in Canada. It was also a very important time for agricultural crops, particularly our berries and our cherries. And agricultural workers were working out in extremely high temperatures to get those crops in. We do have regulations here in our state to help protect workers, to make sure that they have access to sufficient water, that they have cooling stations, that they can protect themselves. But we need that everywhere as we get a lot hotter.
Thank you very much, Chris. So we're coming to the end of our session together, but I'd like to take one more question because it's a good one from Elizabeth. Before I ask this question, I'll just invite the panelists to help answer by typing some of the remaining questions that we're trying to answer live in this session. So it's from Elizabeth. Could a presenter please speak to some of the challenges in workplaces, especially for vulnerable workers or workers with less agency, and the team's reflections on this particular area of life? I don't know if someone can quickly take that one.
I can just underscore the comments I just made, that many outdoor workers are not in a situation where they do have agency. There are growing numbers of stories here in the United States of outdoor workers, agricultural workers in particular, who have died during heat waves because they didn't have access to cooling or sufficient hydration. And it is an area where we need, as Virginia said, to really reinforce our regulations and to get this information to policymakers so that appropriate actions can be implemented to protect people who cannot themselves protect themselves because of their situation.
And just to underscore that comment from Chris, is that there's some excellent work from Tord Shellstrom, for example, that has discussed the impacts of future climate change on occupational productivity, but also occupational health. I think one of the things that really struck home for me when reading Tord's work in that area is this notion that a lot of people in other parts of the world are not necessarily paid by the hour, but they're paid by productivity. And one of the ways in which we protect against heat exposure is by slowing down. So if we're working in a hotter world where we're getting paid by productivity, then there's a tendency to slow down. Then people are going to be spending more time at work, and this is clearly, not a great outcome. So finding ways in which we can accessibly and sustainably cool people when they are in the occupational workplace is an urgent need.
Thank you very much. So I think we're at the last minute of our session together. I want to thank my co-chair, Ollie. I want to thank Chris, Ollie and Tony for your skill in leading this series, and congratulations. All of our amazing authorship team on this Zoom call and outside. I would like to thank our guest panelists for your expertise and generosity of your knowledge and your time. To the University of Sydney support team, but who also supported this series from its early days with workshops, and particularly tonight to Nicole, Mariana and team, and at Monash Nina for assisting the launch of this launch. And last but not least, the infallible, unstoppable Lancet team of editors and managers and journal assistants in London and elsewhere behind the scenes, particularly to Emily, Jenny, Marco, Pam, Sean, Hannah, Lucy, Genevieve, Rebecca, Richard Lane, and Richard Horton, who has created this platform for global and planetary health for us to share. Thank you all who've joined us, and stay in touch, stay safe and well, and good night from me in Melbourne.
Thank you, Selina. Goodbye, everybody.